have them let you know and explain that as well.
That still, it trips me out. I don't even see how that's legal.
So I hear what you're saying, I understand that, but there's reasons and multiple reasons for that based on, you know.
Right, patient, I understand privacy,
Okay.
I understand privacy very well.
Okay.
But now, that has nothing to do with the business of the board.
This is a healthcare facility, they're discussing matters of that, and sometimes
Right.
issues do come up, and there are people and family members that are in board meetings as well that have rights, that are talking and discussing things. So there's a couple multiple reasons. That's the one I'm speaking to as the director of nursing. So we do have to ask that you leave your camera outside in the car.
It still doesn't sound
Okay,
appropriate,
clear
it
up
sounds
and have them further
unconstitutional.
explain in the meeting if you like, but that is what we
I
follow.
mean, if it's a public meeting, it's a public meeting. Is this a private entity or is it, it's a special district, right?
So there's a public forum section, right, where you guys are allowed to be in, and then at that point you
Well,
can ask the question and have them further explain. And there are other people and family members that come in and other matters that are discussed. So that's on my level for the director of nursing, but you can ask the question in there and have it further explained as well.
Right, well, none of it makes sense. It sounds deflective and inflammatory, actually. It sounds very insulting. Hi, I'd like to be able to record the board meeting that's about to occur right now.
We don't have any recording, sorry.
That doesn't make any sense. You're a public entity.
Yeah, we don't have any recording and no picture taking.
That doesn't make any sense at all. You
You're
are a
welcome to
public,
join.
is this a public funded board?
Yes, you're
It's a
welcome to
special district,
join.
correct?
You're welcome to join. You're welcome to be in the meeting, absolutely.
And why is it not recorded? Because of personal, I mean, during a meeting, you don't, that's what closed session is for.
We don't have a closed session. It's a normal meeting. So you're welcome to join. We have seats available. You're welcome to join and be a part of it.
Well, and there's no reason for it not to be recorded.
At this moment, that is just part of our policy. We just don't allow for that.
That
But
doesn't
you're
make any
welcome to
sense.
join. You're welcome to come on in and have a seat, and we'll get started in a few minutes if you'd like to come down.
Transparency and accountability, you really should reconsider this policy.
Absolutely. But
Yeah,
for now, you
absolutely.
can come
That
in, you
doesn't-
can be a part of it, and you can listen into the meeting.
You're real good at nonsense. Why don't you just be honest and straight and direct? Absolutely, you're going to consider
informed
it?
that. So you're welcome to come in. If you want to register with Celia and take your temperature, you're more than welcome to come on in.
Mm-hmm.
Okay? All right.
Should be recorded. I don't see why there's
Come on in.
a
Come on in.
concern.
You're welcome,
Because, you know,
sir. You're welcome.
what you said
I
just
welcome
doesn't
you
even
to
make
the
sense. Every
I
other
welcome
board
you
meeting,
to the
I go to every board meeting around this whole county, the Tri-County area.
Yeah.
And this is the first person to tell me this. Out
You're
of
welcome to
7,
come
8
to our
years.
meeting. You're welcome to listen
So it
and
sounds
take
highly
notes.
irregular.
Take notes, and you're welcome to join us, please. Our doors are open. Come on in.
Well, then there should
Come on
be
in, sir.
room for a
I'll
camera.
take you down the hallway.
Absolute
if you like.
accountability and transparency.
I'll take you down the hallway if you like to join our meeting.
That's what needs to happen.
So,
you know.
Did you take his temperature, guys?
I have not. She's
Okay.
in the process of registering and then, yeah.
Okay. So whenever you're ready, we can do that for you. Thank you.
Try something real quick.
Wes, your camera needs to go a little far.
Actually, the code says anybody from the public can come and can record and videotape, and that's what the law says.
So that'll be a matter, I said you'd be welcome to ask further into how it
Right.
outlined and explained in there, but as of now, there's no camera
So
recording. And that's
It's a
as
violation,
instructed
it's
in the way that
unconstitutional.
it's always been in the building. There's other people that may come in, as a director of nursing, there's other people that may come in and family members that there's discussions of other matters, so that is
Well, it won't be at this meeting because there's only one thing on the agenda.
for
But
protection. So, yeah, that's our process and procedure.
okay.
You're welcome to come in, I can show you to the room, but you can't have the cameras. It's still the same as what we
Is
discussed a little bit
is the
ago.
chief of police coming?
Is that?
The chief of police or somebody else?
I don't.
No, he doesn't usually attend. I mean, they're welcome to, but they don't attend the meetings unless
Yeah. Well, this-
invited or show up.
This is a publicly funded special district
I
with
hear
public
you.
money, which means you cannot censor people from being a video.
I hear you, and you're welcome to ask in the meeting, and they can probably explain in that public forum that this is our process and how we do it as a, still this whole time
You're looking for a lawsuit.
for clarified.
You are really looking for a lawsuit.
And again, the board members are in there, the CEO, our CEO is in there as well. So this is just the way it's always been when I've been here as well.
Right. No, well, just because it's the way you do it, don't mean it's right. I'll be right back.
Thank you.
Scaredy cats. You worried about transparency? No, you're not.
Call meeting to order. Roll call, Sophie.
Greg,
Here.
Maggie, here, Rosemary, here, Ann, here, and Michael.
Present.
Please join me in the salute to our flag.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Rosemary, please take the please.
Our mission is to anticipate and provide services to meet the needs of the healthcare needs of the people we serve.
Thank you very much. President, welcome. I just want to give to everyone kind of the reason why this special board meeting was called. I suggested it to Ida. Given the financial situation that we are currently in, and just so you know, I'm sure you've seen what's going on with Hazel Hawkins. They have to take a $3 million loan. They're going to have to pay that.
They got it.
They did their job. They're going to have to pay that back.
They got it from the state.
Yep. Madeira Community Hospital is closing. Their community hospital, their clinic, because of their financial issues. I'm assuming you all remember about a year ago, Colinga, their SNF, their skilled, and one of the major problems with all of this is medical reimbursement.
Did Klinga ever reopen?
Not to my knowledge, and that includes the clinic, their SNF, and their hospital. So what we're experiencing, like you know, me had a similar situation not too long ago, SBMH and Natividad. So
did you see that article about me in the paper?
in the Monterey Weekly.
Yeah, did you see that? There was did you see it? No. And it, same thing,
Yeah.
you know, restructuring and refinancing.
And you're trying to get.
Yeah.
So, so I call this, I asked Soledad to suggest that we have a special meeting to review the current financial situation of each of our entities, because and we want to make sure we have enough time to really discuss it so that we're all aware. I try to include that on a regular meeting. It's going to go on forever and ever, and so that's the reason I did that. So any questions on that? Okay, so under public comment, does anyone have any public comment?
Does it have to pertain to the agenda item?
It would be
For things that are not on the agenda?
Anything not on the agenda.
Okay.
You have 3 minutes.
Great. Hi, my name is Wes White, Salinas, Monterey County, I guess community enthusiast. Wes White is my name. WESWHIT. I'll give you a card on the way out. I do a YouTube channel. It's called John Doe 13K. I've been following every single board that I can find: water board, school board, hospital board, and just trying to promote transparency and accountability and in community engagement, so at least people know what's going on and have a chance, opportunity to figure out and go, yeah, that's right, you know. I try very hard to be polite. I'm very frustrated that I cannot record this meeting because this is publicly funded, which does sound unconstitutional to be blocking the recording. That bothers me immensely. No video or pictures allowed. It's about transparency and accountability. That's about the only thing I really worry about, and people in general, taking care of people. I'm a big homeless advocate, and you know, this is a caring profession. I used to be a substitute teacher. It's about caring, and the money ends up coming in the way. Just need it to all add up. There are people who can crunch those numbers. I cannot, which is why I like just relaying the information. And you know, it should be community engagement. This feels like separation, isolation, not really community engagement. I'm not feeling it, and I'm really disappointed. I hope you reconsider this policy and allow me to video in the future. I do feel like it's unconstitutional, and I feel like I should file a lawsuit, and I'm very frustrated about that.
Thank you. Hey, Treasurer's report.
So currently, we are,
Oh, thank you.
we've closed the books through November. I have just received the revenue information and, for the month of December, and I received the bank statements yesterday, so I am working this weekend and on Monday to close the books of December.
For December?
For December, okay? Our goal is always to have it done by the next board meeting, but we're trying to expedite that a little bit to try to get the books closed in about a 2-week period. May be difficult, but you know, like I said, I just got the information Wednesday evening for the revenues and the bank statements yesterday, so we should be able to get those done in a couple days here. Okay, so what you have here is through November. These long sheets are a history of the clinic as well as Eden Valley. So I'd like to start by going through those, okay, and kind of give you a summary just so that you have an idea, and then you can kind of see trends as we approach this. So let's start with Eden Valley. You should have one sheet that says Eden Valley at the top, and then another one that says Soledad Medical Clinic Women's Health Center. So is everybody with me?
Yes.
Okay. So Eden Valley Care Center, this is, I've done a history from July of 2020 all the way through November of 2022. So let's just stick on the front page, which is the year ending June of 2021 and the year ending June of 2022. You can jump down to the bottom line over to the far right. You can kind of see that our net income. Now, what you have to remember is that Soledad Community Healthcare District basically has 3 entities. Okay, it has Eden Valley, which is the SNF, and then it has the Soledad Medical Clinic and Women's Health Center. Okay, and then it has district-wide expenditures. Okay, and I have not prepared anything for the district-wide expenditures. I have part of the budget for that a little bit later, but I haven't done a history because in the past, until about last year, maybe 18 months ago, the district-wide expenditures were all incorporated into one of the 2 entities. And so we don't really have a 2-3 year history of the district. It's more of a 1 to 18 months history. And I can put that together, but I just haven't put it together yet. So the district-wide expenditures basically has salaries, and it has some legal expenses, and it has some supplies that pertain to the district-wide. Some of the salaries that are included in there are your human resources and some of the administrative staff. Okay, but so what we're looking at is just the operations of Eden Valley here. So under Eden Valley, for the year ending June 21, we had a loss of $554,000. Now, you'll also see it was negative. I've separated the depreciation. Depreciation is where you take an asset that you purchased, or like a building, then you spread it out over 35 years. And so it's not a cash expense, it's just a reduction of the asset that you purchased many years ago. Okay, so the actual cash loss for Eden Valley for the year ending June 21 is $466,000.
So I understand depreciation was confusing, but like in July of 2021 it was only $67,000, and then it's like $267,000 in May. What makes that depreciation value change so much? Or is that a controllable thing?
Where are you looking?
Well, income loss before, forgive me. I was reading income loss before depreciation.
Okay.
So that was an odd question.
Yeah, no, it's okay. So the depreciation for Eden Valley was about $6,600 a month.
Yes.
Okay, for the year ending June 21. Okay, now compare that to June of 22. You know, we have an overall loss of $753,000, $200,000 higher than the year before. And you can kind of look at, okay, so what are the differences? So the main difference is if you look at the first line, your Medicare revenues, you got $3.2 million of Medicare revenues, in June of 21. Our Medicare revenues for June of 22 is $2,737,000. So that's a drop of about 500,000. Okay? We had some increases in our Medi-Cal revenue. And we had some increases in some other revenues. Other revenues would be private insurance or other insurance, as well as grants and those type of things. Okay?
Got it, okay.
All right? So those are your revenues. So our revenues actually, from 21 to 22, actually went up $290,000.
Where do you see that at?
So total revenue, $6.7 million in 21.
Oh, that's it.
Versus $7 million in 22. Okay, an increase of approximately $290,000.
Gotcha.
Now, look at your expenditures. So expenditures, we had $7.1 million in 21. We have $7.67 million in 22. Where are the increases? Okay, the Medicare certified unit, that is down. General administration is up about $300,000. Employee benefits is up as well. The main reason for the employee benefits is the implementation of the retirement plan. Okay, where the district began to match their contributions to a certain percentage point. Okay. And going down, there's not many differences other than that. There is, in each of the different, I can get you detail for any of the departments if you wanted to see an increase of why general administration went up. I can provide those to you. This is just in general so that you can kind of see where things are, and we can provide the detail if you would like.
That detailed analysis would be helpful to really look.
Okay? So I just need to know what you want to look at, because you also understand that, there are a lot of deep line items in each of these. If you want kind of a summary of what's in those kind of expenditures, I can provide that. I just need to know what you want to look at.
You definitely know the breakdown. If you start looking at the budget, you got to know what those are, so you can say, okay, this is going to be the same, this is not going to be the same kind of thing.
Okay, that's our budget. That's different, and I can show you that later. Okay? All right. So then, let's jump to the current. But if you look along the lines, you can see that we have some months that are really bad and some months that are okay. And with Eden Valley, it's all based upon your census. It's all based upon how many people are in the SNF. We have done a comparison. It was done 5-10 years ago, probably 7 years ago, when Steve was still here. We did kind of to determine where our incomes were generated. And we determined that in order for Eden Valley to break even, we had to have, I think it was approximately 15 to 18 Medicare patients, and we had to reserve enough beds in order to make sure that when a Medicare patient was willing to come or could come, that there was a place for them. Okay? Obviously, you can look. There are months in which our census has not been good, and it can be seen by the results here.
Medicare rates are greater than Medi-Cal rates, but not as good as a single payer if they were to have other insurance or pay out of pocket, correct?
Medicare gives us the greatest percentage of revenue, even better than private insurance.
Is that because of the rural health clinic issue?
Yes.
Okay.
Okay. Anne, you had a question?
I was just going to say, in October of 21 to November of 21, it was a deficit, and then it showed a great income. Was there some money that came in?
Yes. So if you look at November 21, if you look at your other revenues, they're typically anywhere from 60 to 100,000. but we had some grant monies that came in that November. And that's that 565,000.
Good memory, going back to 20.
Well, I was, when I was putting this together, I was like, that looks a little long. What's going on there? What was going on there?
That's good.
So when you look at other revenues, that's typically what it is. And it's either incentive money, you know,
What kind of
the incentive,
Oh,
okay? Or it's grant money, or it's, you know, there could be an adjustment in some of the previous revenues,
okay.
okay? But that's typically what it is. I mean, if you look across there, typically it's anywhere from 60 to 100,000 in miscellaneous revenues, which would be your private insurance, other insurance, and donations and those type of things. Okay? Now, if you look at the second page, you can kind of see where we are today.
Oh,
So, I mean, if you look across there, you know, to have a 930,000 or a 1.3 million dollar loss, you're losing about 100,000 a month on the average. So July and August were bad, and we had a $187,000 loss. I'm looking before depreciation in July, and in August we had a $148,000 loss. Census was good in September, and then in October, November we've been close to break even.
do you know
Okay.
what the census was in September of 22?
30,
How many?
about 30.
About 30?
Yeah, that's been our average, and looking back in a 10-year stream, that's probably been about our average. And remember, a lot of it, because of COVID, and we actually have it again in the building,
Yeah.
creates an inability to add additional, and on top of that, you had sick employees. And so those employees weren't able to work, and in turn, we weren't able to staff any additional residents. Right now, I'm really happy to say we only have 12 beds left.
Oh, really? The census is that high?
The
Oh,
team has done a
wow.
wonderful, wonderful job.
And this is in January. What was it in December? Any idea?
We were probably in the 35-ish.
Oh, wow. So it's really
Yeah,
gone up.
the team has been working very
Oh, wow.
diligently in trying to get up, so we're at 41
Yeah.
right now, and we have 3 in the pending. So we should
Three
be,
pending to come in?
Is
Yeah.
those rehab or those all long-term care?
it's a combination of,
It's,
I mean, ultimately, is the rehab is that pays our bills.
Right.
A Medi-Cal does not. It, on average, and I haven't looked at the last cost report, but I think 2021, it cost us $545 a day. Okay, Medi-Cal was paying us $389, had a loss. And so we got a little increase. I think we're now $406. It's still not enough. We're still running at a loss.
oh, do you have any privates?
We do, but again, our private pricing is still not where it should be. It's pretty much the Medi-Cal price.
Yeah.
And so we're not making, so yes, we do have some privates, we do have some, so we have 13 Medicare right now, 3 privates, 25 Medi-Cal. for
How many
2021.
25?
Mhm.
Oh,
Yeah, and we only have, like I said, 12 beds left.
oh, wow.
So really the payout to us comes in the physical therapy, the speech therapy, and those kind of services. That's what helps us create that balance and close in that gap.
It's gonna be interesting to see what the financials show for December. You know,
My
it says-
understanding the December census was,
Pretty good?
I mean, it was okay.
Yeah,
So hopefully it, you know,
In
hopefully
line
we're
with-
a break even or maybe a little profit for
Closer.
December.
yeah.
Yeah, so it should be a break even. Maybe,
That- I'm sorry.
go ahead.
I was gonna ask, so that Medicare 425-ish, whatever that number is, that includes the rural health rebate, or is that separate?
They're 2 separate businesses,
Okay,
so you have to treat them entirely separate. It's a whole different,
We don't get rural health rebate
No.
for Eden Valley?
no, they're 2
Thank you.
separate businesses.
Thank you.
Yeah. There's a whole different
Okay,
type of.
that makes sense. I didn't realize whether Eden Valley got that also. So
No,
It
this-
doesn't, that makes sense.
This is a SNP, so we have our own rules.
Thank you.
Okay. So right now, through November, for the 5-month period, we're at a loss of 188,000. But you can see the expenditures. you know, in November, when was the salary reduction where we took some?
November 1st.
November 1st?
So that was
So you can kind of look at, you know, we were averaging about 580,000, then 568, then 559, and 511, and now 495. So expenditures have been cut to try to help alleviate some of the issue as well.
Oh, that's good.
So, you know, staff is making those efforts to try to reduce the cost, especially during the times when the beds are not full. Okay? Any questions on Eden Valley? Okay, questions? Now, historically, I mean, if you want to go back 20 years, we had a board member that, you know, the Eden Valley was making money and the clinic was losing money. And we had a board member who wanted to cut, you know, eliminate the clinic. And, you know, there was a lot of noise about possibly doing that. But the board of directors, as well as the director at that time, made a real effort to try to improve the clinic. And for the last 5 years, up until last year, the clinic basically covered any losses that were sustained at Eden Valley. Okay?
They're both important.
Yeah, so they're both important, but, you know, over the years, we've never really had a time where both of them were doing really well. We've had a time where Eden Valley was covering the losses of the clinic, and then we had a time where the clinic was covering the losses of Eden Valley. And so, what's happened in the last year and a half, 2 years, is that they've both taken a dip, and they both have struggled, and so that's why we're in the financial crisis that we are. Okay? So let's look at the clinic. Once again, this is just a history, and if there's any detail on any particular item, I can provide that for you. The Women's Health Center was it March of 20? When did it
When it
open?
actually opened was in the end of the year, December.
21? Yeah. Okay, so you have to realize that some of these expenditures are going to be a little skewed because the Women's Health Center came into effect really January of 2022, somewhere around in that neighborhood.
Now, some places we break it out into 300 feet, some places you lump it together.
It's because the revenues are not easily distinguishable based on the information that I get, and so I can't break out the revenues for the health center versus the clinic, and so we just combine those for these purposes.
Okay.
The expenditures we can keep track of easily, but the revenues are difficult to break out, and so that's why I combine.
And don't the personnel go back and forth between the two places?
Yeah, absolutely.
Yeah.
At the clinic it does.
Yeah, the clinic,
It's all shared.
Okay. So you can look, you know, if you look at your monthly net income loss before depreciation, just so you see, you'll notice that the depreciation for the first year, June 21, is about $7,000 a month until we get to June, and it's $95,000. Okay, and then you look at the next year, and it's about $19,000 a month. Okay, that is because that's when the Women's Health Center became operational, and so that's when we started depreciating the building. In June of 21, we went back and recalculated the depreciation with the new assets, and so that was an adjustment that was made there in June of 21. Okay, so it's typically about $19,000 to $20,000. You'll notice down in April of 22, there's depreciation of $173,000. That's when some new equipment was purchased, and we had to do an adjustment for this particular year as well.
Sorry?
Okay? Sounded like a subway, or a submarine.
Yes. But I thought it was on quiet, so it shouldn't be making noise.
Okay. So what I've done here is you have your gross revenues. These are our monthly gross receipts for the clinic and Women's Health Center. Contractual adjustments. Then you have the PPS settlement. Okay, and these are just estimated amounts. Actually, for the 21, those are actual amounts at this point, because those were determined by our auditors. The auditors determined the PPS settlement.
But can you also let them know they made that 400,000?
Yeah,
Okay, so they estimated $1 million, and then the state came in and audited their work, and it actually was 1.4 million, so there was another 400.
And I'm paying that now, that's $36,000 a month.
Okay, so we have estimated for 22, but we have not heard yet from the auditors what that number is. Okay,
And that number is the Medicare rebill or
It's a PPS rate.
PPS rate?
So we have a shortfall of $400,000.
okay, and then on this, it's not broken out by department, but for the clinic, it's easier to kind of look at this based on type of expenditures. So you have your salaries, your doctors, supplies, which are vaccines and all those type of expenditures, professional fees, which typically are your legal, accounting, and those type of things, contractual services. But in the event that we don't have a doctor or we don't have a particular medical staff, and we have to go out and hire somebody, the traveling nurses or any of those type of individuals, that's where those expenditures fall.
It costs us 3 times a staffer, or about $30,000 for 3 months.
And that's under which category?
Professional fees,
Professional fees.
because we're gonna look at that line item, because you're gonna see that line item just grow.
So
That's
as
when
you
you get
guys
the
recall-
temporary doctor.
Well, as you guys recall, Dr. Jackson resigned when she
Oh,
was.
that's right, yeah.
And so the idea is do we stop services or do we continue services? And so we didn't want to leave a gap for the community to not have a pediatric service. And Dr. Camboa couldn't come on until October. So we hired the agency doctor, but agency doctors come at a price, and it's a very costly price. And to the tune of about $30,000 to $40,000 for 3 months of service. So did we make any money? The answer is no. Did we keep the community happy and supported and get what they need? The answer is yes. And that was ultimately our goal. But you will see the price that we paid in return for that.
Oh, that's under professional fees?
Yeah, so those,
And
So
that's when
you see
get
that the
large,
doctor's fees kind of went down because you lost, the doctor. You lost the salary of the doctor, but in turn you made up for it on the professional fees.
Yeah, and then over in August of 22, you can see where the professional fees were so high.
Yeah.
August
So
and
we-
September.
So I'll be happy to say, as of the the 23rd, we have no more professional fees.
The 23rd
Of
December.
December.
Okay.
No more traveling folks.
no more travel.
Oh, that's good.
Is that in there in the professional fees, that's separate?
That's in there.
yeah,
That's in
and
the
Tivinet is part of the professional.
And that's why it's a lot less.
Okay,
It's those agencies, when you go through an agency and hire, there's the cost.
okay. So, just looking at revenues, so bottom line, before depreciation, for the year ending 21, you had a $691,000 loss, including the PPS payback. And then in 22, you had a bottom line loss of $931,000. Okay? Now in 21, if you look at the financials, I mean, if you go back to the Eden Valley and you have a $466,000 loss and you have a $691,000 loss for Soledad Clinic, you're thinking, oh, we lost $1 million. Well, in 21, you have to remember that we also got a grant to build the Women's Health Center that was like $1.4 million that offset that. And so the financials looked like we showed a $400,000 profit. Okay, but it was because we got all this money to build that building. Okay, but operationally, these were the losses that were sustained.
And we also need to remind everybody that there was still an outstanding balance that was owed to the building of the Women's Center. And so instead of us going and getting a loan to pay for that, we paid out of our cash reserves, tanking our cash reserves and leaving us with less than $1 million.
And that was when,
During
because it became way over budget, remember? I
during
remember
Gary's time.
when Gary's time, and
Yeah.
it became It was.
And there wasn't a plan put into place on how to make up for those reserves,
No.
right?
No.
And
Well,
so-
the other thing was trying to generate the patient visits
Correct,
to pay back what
yes.
it costed for that building.
And that's another kind of element to it right now. A patient visits, on the average, providers were seeing 13 to 15 patients.
Over there?
So we're trying to get them and talking to, Natividad and all of the other providers, 24 is what they should be seeing.
How about the mammograms, are those?
And it's a service, and
Right.
it's gonna take time. And remember that it really is only an attraction.
Oh.
It's only an attraction, because a lot of the services we provide are to women who are in Medi-Cal. There's some other programs. And so we can charge $600, but they only give us $100.
How many patients, in order to break even, how many patients do we have to average per provider? 24, okay, and what are we more doing?
We weren't doing that, and we're still not doing that. I still have some challenges, in and around that. We've gotten a lot better. I think we're up to 21 some days, or I know there's slow months. December, January, March, and actually Dr. Pena tells me yesterday, oh, it was a slow day.
It's what?
It was a slow day, he said to me yesterday.
Well, he's a busy man.
Yeah, but again, because we're trying to get those, and remember, that pays, for 2 MAs. That pays for all of our supplies. That pays for all of the infrastructure and everything that goes along with it. And so it only benefits us, to make that happen. And bottom line, guys, it helps serve our community. So yes, we may see it as, oh, we need to hit this market, but the reality is, I have a walk-in list every day of nearly 30 people that I need to see. And so if somebody's able to see 1 or 2 more people a day, then that's 1 or 2 more people we helped out of our walk-in list and out of our community.
Thank you.
Okay.
So, going to the current year, you can see that in August and September, what I like to look at is my net revenues. So it's like the 5th line item down, 451,512, 487, 573, 433. Contractual adjustments are in effect. Okay, and it also depends upon our billing, whether it's in-house or whether it's Athena, whoever is handling the billing, when those contractual adjustments hit. It would be really nice to say, okay, we have $1.2 million, we can count on receiving 50%, 600,000. But some months, the contractual adjustments are 40%, some months are 60%, and I don't know what those are until I get the month-end reports.
So a lot of these numbers are estimations because we don't know sometimes till a couple months later.
These are actual,
Those are actual.
but
This is
these are actual, but it's based on when those receipts were actually recorded. So we could have $1.2 million in revenues, but we may not have the contractual adjustments for those until the following month.
Right.
And
Okay?
these are not a cash base, this is an accrual base.
Right. Okay. Yeah, you already mentioned the professional fees. I was going to draw your attention to that. They were extremely high in August and September, but they're back down in October, November, and hopefully, from this point forward, they'll continue at that level. You'll also notice that the doctors, were at about 88,000. Now they're 92, 93, so they're climbing. And that's because now we're going to see that balance between the two.
So provider salaries, the doctors, the only ones coming are doctors, the PAs and the nurse practitioners are all part of salary because it's a
Correct.
different contractual agreement with the doctors than it is the other providers, right?
The doctors are self-employed.
Right.
Yeah, the salaries are anybody that receives a W-2, doctors are those who receive a
They're
1099.
1099s.
Got it, thank you.
They're contracted for us.
Okay. Other than that, I mean, your utilities are stable, your insurance is stable, your, you know, all these other expenses, interest, you can see the interest. You know, we, like Ida said, when we finished building that building, we had taken our reserves from like 3.5 million down to less than $1 million. Because there was no financing in place to cover that. We have since gotten a loan to help to pay that. So now we have this huge loan on the books, and so you're gonna see the interest, you know, it's at $15,000 a month, and then with the rates going up in November, we're starting to see an increase in the interest.
On the loan?
Yeah, it's going to be.
Or on the,
Yeah.
Well, the loan's a fixed rate interest.
It's a
not a
fixed
fixed
rate on.
It is, it's
Oh.
450,
how much is it?
4.50 is
On the,
right next to that.
on the loan?
Yeah.
Okay.
But that goes back to, that helps us with our cash on hand.
Absolutely.
Remember what the auditor said, they wanted that cash on hand number to be good, so that gives us a little bit of cushion there.
Yeah, absolutely. I mean, ultimately, my goal is to get us to 6, in a normal business, it should be about 6 months,
Yeah.
3 months.
Well, when they
maybe.
first came in, we were good because we were, you know, we were at 90. And he's like, oh, we don't see
Yes.
this. And then we dropped down to 35 or 32, but now we're back up a little bit, aren't we?
Yeah, so
I think the
we,
last one we were at 45.
We're at 45.
yeah.
Good.
I think in November we were at 45.
How much of that 3.9 is in cash reserves and how much paid off some actual women's health center?
There is no cash reserves. All that money's been allocated. So, it was about $1.1 million was my first loan, I think.
Right.
And then we had to get another 2 million. And what has been allocated to is the PPS. PPS were in the rears, over 2 million, and that's only for years 19 and 20. And 21, we still owe 22, and we still haven't gotten the bill for that one.
Right.
So we're
We
gonna
don't
have
know
to
that
figure
number
out
yet.
how we're gonna come up with $1 million
I still think the
in
state
2 years.
should write that off the books.
That would be nice, but
Wouldn't
it's
it?
not likely.
Forgive.
I mean, yeah, the reality of them wanting to,
Yeah.
write that whole thing off is gonna be.
So you have to remember, the other thing to consider as a board member, so when you look at the clinic, so let's just take the month of November. Okay, so for November, we had $142,000 loss, and you'll say, well, I thought we had kind of turned the corner in October. Well, look at the contractual adjustments. So the contractual adjustments for October were $590,000 on 1.2 million of revenues. In November, we had almost 4 million, but we had 843,000 of contractual adjustments. So they were catching up on a lot of their charts. Okay, the billers. Okay, so we had 573,000 in net revenues to use in October. We only had 433,000 of revenues in November. Now, the thing you have to remember is, for Eden Valley, you know, we showed a $5,000 loss for the
And
month of
this is
November. Okay, and we showed a $142,000 loss for the clinic. So you're thinking, okay, so we lost 147,000. Okay? But in reality, you have to take into consideration the district as well, and on a monthly summaries, I provide that too. I just don't have it in these annual summaries. You also have the district-wide expenditures, which run another 40 to 50,000. So, you know, it's not 147, it's more like 187,000. The good part for that was that contractual adjustment surprise, because I don't get these numbers till the end of the month, and then I look at them and I go, oh my gosh, what happened? So,
I have a salaries question, but to make sure, looking back at Eden Valley, where we don't actually say salaries, but I'm sure, so nursing administration is some salaries primarily. and housekeeping and laundry is salaries primary for those
Right.
areas. So the salaries are breaking out more here, where here they're lumped together, is that
Right.
kind of correct?
For Eden Valley, the history of the board as well as the director, they wanted to see by department. And so that's why I've always shown it as department. But in the monthly reports that I give you, you'll see combined salaries for both Eden Valley and the clinic. So you'll see both of those. Okay, so you can kind of see, you'll be able to see a drop in salaries from month to month or an increase in salaries. You'll be able to notice whether or not, we hired more individuals or we've we've reduced the amount of hours that are being worked. So you'll be able to see that. Okay? But I can adjust, on these monthly reports, I can adjust however we present the data to whatever you want to see. So I just need input from you as to what numbers do you want to look at. Do you want to focus on these professional fees? Do you want to focus on salaries? Do you want to focus on the revenues? Whatever detail you want to see, as long as the data is available, I can present it. So
I think especially now while we're dealing with shortfalls, it's more important to kind of break down and look at what those differences are, so we say, oh, this is getting better or not getting better. Because when it's lumped together, that might have been a positive number, but was there a negative added in there? So without breaking some of the lines out, we don't know what went better and what went bad that month. We just know what the overall is. And if things are rolling, then those numbers look good. But we're trying to analyze and figure out how our shortfall.
What would you like to see broken down?
Well, I don't think I want a 37-page report. But I mean, it's summarizing, or at least getting idea on some of the, and maybe we'd have to look at each of these lines and sit down and say, well, what does this include? Okay, that'd be helpful to have it broken down so we can analyze, because when you're talking salaries or whatever, what's changing? And without seeing those breakdowns, we don't know.
Well, and I think what you could do is, because salaries are one of the biggest expenses that, in any business, your salaries is the.
And there's probably no negative there. Salaries is salaries, so that may be a bad example.
And remember, in
But that's your greatest
and
expense.
in healthcare,
Yeah.
your nurses, your providers are your biggest expenses.
That's your biggest expense though, is salaries. And when you go to try to save money, that's where,
And in reality, remember you guys, all the salaries have gone up substantially. During the time of COVID, nurses' salaries went up 30–40%. I'm starting to see a decline in when I'm bidding out new nurses, but
Well, did the overtime play a part in that?
during COVID it certainly did.
Yeah. But that's where we almost had no choice because it was during COVID.
Well, during COVID, we paid, just in, and I'll give you guys an example, so just in, a period of this last year, if we talk about this, so from, January till January, all of 2022, I should say. Our gross pay was roughly about 8.2 million. We paid $284,000 in overtime.
That was because of COVID though, right?
Well, a lot of it was that, and a lot of it was just misuse of the time clock and management. So it's really getting folks to pay attention to that. And clocking out properly, clocking out on time, and those reasons. We paid an additional, for folks not taking their breaks, meal break violations on time, $53,000.
So what is it, an 8-hour day and it's overtime after 8 hours?
Yeah.
So the 53,000 is a huge overtime, just because people are not taking it. They're
Well,
looking for overtime.
and then what happens, I think, and correct me if I'm wrong, but then it also falls into employee benefits because the salaries get higher than the contribution.
Well,
Is
no,
parallel?
remember what we did, is employees, got a insurance plan, and they had to pay into it. What I was able to do is renegotiate our entire insurance plan, so that to make it affordable, but in addition to that, they were able to get dental and vision.
Oh, okay.
Right? They didn't have any of those options. Now they're fully covered, and they're paid on us. And so that may be another thing to, not now, it doesn't come due until our fiscal year, is maybe considering having to cut that back a little bit and the employee contribute a little bit. But, you know, being a rural health clinic, it's really tough to get good employees, and so that's kind of like a sell for us.
Yeah.
And an ability for us, cause you know, we're in a rural area and everybody wants to go work in Salinas, doesn't wanna work here.
You know, which brings up the thing, I was kind of surprised when they gave that COVID, that new thing for the rural health clinics, that they, you know, they gave it to Clinic of Salud. Did you see that?
They're a federally funded, we're an entire separate entity.
Okay.
You can't compare us because they have bigger pockets they can line in, they have bigger, you know. Yeah.
And they're paid more per patient than we get.
Really?
And they're federally qualified
Yeah.
healthcare provider. Before I got here, when Steve was here, we kind of looked in to see whether or not, because we're providing much more care to that patient population that they're supposed to be serving.
Yeah.
But the political connections that Cuevas,
Yeah, he's a CEO.
yeah, and so if you look, they have 2 PAs down there.
Uh-huh.
That's it.
That's it.
And they don't, and walk-ins, they don't accept them like we do. You have Mission Center Healthcare who just went into a urgent care. They have no doctors, and they haven't had doctors for days.
Really?
So we're it, you guys. We're it for the community, and so the service we're providing.
It's not fair that they get more than we do.
So I did talk to CCAH the other day. I did have a conversation with them, and explaining that to them. That, you know, we need their support, because we're the only organization in town that's really providing this type of service. And so.
I think they realize that. don't
They do, that's what she said. And they're very thankful for what we do.
Yeah.
So to address part of your breakdown, so I've used QuickBooks and I've used Intact, and I understand this chart of accounts, which can be very crazy, and we probably have 87,000 pages of charts of accounts to break things down, right?
Mm-hmm.
So would the easiest thing to be sit down sometime and talk about some of those to try to analyze what to look at? Would that be easier than saying, give me everything? To sit down with you sometime and start talking about what some of those charts of accounts break out to be, and ask that by asking for all of them?
Sure.
Okay, I'm willing to do that. If that's easiest, to sit down for 30 minutes and talk about those chart of accounts to see, these breakdowns would make sense. Salaries are salaries. There's no negative, but it's always a negative. There's no back and forth.
Yeah.
Does that make sense?
Yeah.
I have, my own concern about that, Max, is you're getting the information, we all need to get the information at
Agreed.
the same time.
Agreed.
So, if there's a specific area that you want, then have Brent bring that to the board, and we all hear it at the same time. We all get the same information, we all get the same opportunity to ask questions.
What I wanted to do was sit down and ask about areas so that you could bring that areas to the board. Because I'm not sure what areas to ask for yet without looking at some of the breakdown. That's what I'm
Understood, but that's the only cap.
The only other thing I would say is I've served on school boards, I've served on a lot of different boards, and you have to remember what your role is, okay? Your role is to set policy, your role is to review governance and those type of things. You hire individuals, you know, Ida and her staff, and, you know, to actually get down into those numbers and look at those individual invoices and figure out, you know, what we can cut. I mean, I can give you all that kind of information, but I can also tell you that it undermines the trust that you have in your staff. And it's important that you focus on the areas that you can control. I mean, if there are particular line items that concern you, by all means, ask questions and we can provide those type of things.
I don't think we need that data every time. I'm just looking at analyzing it when we have a problem, to analyze a problem. That's what I'm doing.
We're going to delay on the budget because I indicated there were some issues in the accuracy of some of it.
So we'll just wait.
Yeah, so I was just gonna do a general, kind of just statement on the budget.
Okay.
You know, going back history-wise, Steve, you know, he kind of did the budget himself and kind of ran the budget himself. never utilized myself or any of the others to kind of look at the budget. Never even, I don't think even presented the budget to the board of directors. It was not used as a tool to help review the finances, okay? So, since Ida's been here, we have now put in a budget. They have used some of their resources to create the budget. And I looked at it, you know, and there are some things that we need to correct. There are some adjustments. Some of the data was entered as negative when it should have been entered as a positive. And so the budget that we have is kind of misleading in certain areas. And so we're fixing that, and we're putting in place tools that we can use to make the budget something that we can help you as a board of directors look at, okay, we said we were gonna spend $2 million, how come we spent $2.5 million? So those are the type of things that you can use, okay? So it is on our agenda, and we are in process. I've started looking at it and reviewing it, and hopefully we can get that finalized here soon so that it makes sense to you. Okay?
Any other questions of Brent? Okay, I have a couple of things. Max emailed me a list of additional concerns, and I did not forward that email to anyone because that would have been a violation of the Brown Act.
Oh, the one last night?
No,
Oh,
he sent another. Okay, so what I'm going to, with the board's permission, I'm going to give a copy to Ida, and I'm going to ask her to address the issues in a manner in which she is able to, given the time constraints, over time, so that the issues can be addressed.
what do you know?
This was an email you personally got last night?
No, this is from some time ago. Max sent me an email.
Oh.
If I had forwarded it to you, I would have been in violation of the Brown Act. I did not.
Oh.
I'm not gonna violate the Brown Act.
Okay.
So what I am choosing to do, so I'm notifying you, okay?
Oh.
I am going to, it's a very long email, it's a list of concerns. I am going to print a copy and give it to Ida with your permission, because I'm just one person. I can't direct Ida to do a dang thing. With your permission, I would like to ask Ida to over time, address those issues either in public session or closed session, depending on what the issue is, so that we all can hear the same information at the same time and get our questions answered. I don't want it done in a mass chaotic confusion where no one knows what's going on because we're dealing with 75 issues at once.
Right, right.
Okay, so do I have your permission to ask Ida to do that?
And these, in the email was concerns
List of
that the
concerns.
public had?
No, Max had.
Well, he was,
Max emailed me before he was on board.
so he was a member of the public.
Neighbor of the
So
public.
these were concerns of the public.
But, yeah, and I don't wanna,
Absolutely submit this. I think, you know.
Okay. And that's, we're all good on that? Okay. Then the next thing, I did receive an email from our lawyer, it was copied to me, that was sent to Max, that was concerning about how.
You're from the lawyer, you got one?
Our lawyer.
Yeah.
It was CC'd to me. I did not, and it was telling Max that he needs to be a little more careful in how he was, as I understood it, emailing us because there may have been a violation of the Brown Act. My concern is that I hope that you're not continuing to CC our lawyer because that's incurring fees.
Yeah, is that okay? Don't we have to pay every time he emails the lawyer?
I only did that because I'd asked her some questions that I gave you, I just following that up, that's
I
why.
just want to make sure
Yes.
because that's incurring costs.
How much
Do you
is
know
it?
that, Max?
I don't know the fee yet.
Max, do you know that we have to pay the lawyer every time you email her?
I had an idea, but I was only following up on those emails, I don't plan to email the lawyer all the time.
Just so you know, that's all.
Well,
Okay.
remember that then.
Okay, also, and this is the last one. I received an email from you last night. Apparently Ann received one that's very similar. So now we have a triangle. We have 3 people that received the same email. I don't know.
Everybody got the email, so we could talk about it.
But see, what you did,
No, I did not.
I don't even
I
check
did
my.
not.
because so what that is a violation of the Brown Act.
Okay.
And so I just want to make sure that you're being very, very careful, because when you and I can have a conversation, not a problem. The 3 of us have a conversation, we have a quorum, and we violate the
You
Brown
gotta
Act.
be here to have that conversation.
Well, yes, so I just want to make sure that you're clear, please don't do that anymore, and I want real clear that Ann and I, whoever else, did not solicit or want that, because that's a violation of the Brown Act. That's all I'm concerned about.
Okay.
Anything else for the good of the order?
So what happens when the Brown Act is violated?
There are repercussions.
Yeah.
And that's why I want to make sure that Ann and I are not, did not solicit, did not ask for, did not participate in that. And so I don't want to be drawn into some legal conflict because it's not something I did.
Well, I think it was, you know, in all defense, I think it was an innocent,
I just want to make sure that's clear,
yeah.
okay? Anyway, is there anything else for the good of the order?
No.
Thank you very much.